And one of the most important things to remember is that NMES is not a replacement for exercise. It's a supplement. It helps you to activate the muscle so that your strengthening exercises are more effective. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle. If you've had a knee replacement and your quadriceps still feel weak or unreliable, if things like stairs, getting up from a chair, balance, or walking don't feel the way you expected them to, then today's episode is about how to start addressing it. In episode 39, we focused on the problem side of quadriceps weakness after knee replacement, why it happens, and how it changes the way people move after surgery. If you haven't listened to that episode yet, I recommend starting there because it sets the stage for what we're going to build on today. Today's episode is all about neuromuscular electrical stimulation, often called NMES. I want to let you know that this episode is a little longer than many of the other episodes. So if you're ready for it, we are just under 20 minutes for this episode, but there's a lot of information. And if you're interested in using NMES or neuromuscular electrical stimulation, I think it'll be worth a listen. Before we go any further, I want to be clear that this podcast is for educational purposes only, and it's not medical advice. If NMES is something you're interested in using, it's important to discuss it with your physical therapist or rehab professional and receive individual instruction that's specific to you. For some people, the idea of using electrical stimulation feels intimidating or even a little gimmicky. But what we're talking about today is not a novelty and it's not a shortcut. NMES is a well-studied rehabilitation tool that, when applied correctly, can help your quadriceps muscle reconnect with your nervous system and rebuild strength at a time when your nervous system is temporarily protecting the joint. Before we go any further, I want to be clear that this podcast is for educational purposes only, and it's not medical advice. If NMES is something you're interested in using, it's important to discuss it with your physical therapist or rehabilitation professional and receive individual instruction that's specific to you. By the end of this episode, you'll understand what NMES is, how it helps activate the quadriceps after knee replacement, and what actually determines whether it works, including how strong the stimulation needs to be, how electrodes are placed, how often it's used, and how it fits into the day-to-day process of rebuilding strength. I want to be very clear about safety. NMES is generally safe when used appropriately, but there are important contraindications and skin precautions to keep in mind. NMES should not be used over areas of active infection, open wounds, or irritated or broken skin. And electrodes should never be placed over the front of the neck or across the chest. Electrodes should also never be placed directly over a surgical incision. If you have an implanted electrical device like a pacemaker or defibrillator, you need explicit medical clearance before using NMES. Extra caution is also needed if you have significant sensory loss, a history of seizures, or circulation problems in the leg. Skin should always be clean and intact before treatment, and you should check the skin after each session for redness or irritation. If anything feels sharp, painful, or unusual, that's a sign to stop and get guidance from your rehab professional. Let's start with a hypothetical situation that's common after knee replacement. Someone comes in after a knee replacement. Their incision looks good, swelling is present but expected at this stage. And yet they're struggling to lift their leg, stand from a chair, or go upstairs without compensating significantly. They might say something like, "I'm doing the exercises, but my leg just doesn't feel like it's working." Early on after surgery, some of that heaviness, hesitation, and lack of control of the quadriceps muscle is expected. It becomes a concern when those patterns linger beyond the early recovery phase and don't improve with a little time and guided rehab. What's happening here is something called arthrogenic muscle inhibition. After knee surgery, swelling, pain, and joint trauma disrupt the normal communication between the knee joint and the quadriceps muscle. Even when you're trying your best, your nervous system may not send enough of the right signal for the muscle to fully activate. This is not a motivation issue. It's not lack of effort. It's a protective neurological response. And NMES can help bridge that gap by directly stimulating that muscle and improving recruitment of muscle fibers while your nervous system is still guarded. And before we talk about how it's used, it helps to clarify some terminology, because e-stim can mean very different things depending on the context. Some of the terms you'll hear describe different goals, and others describe different waveforms used to reach the same goal. TENS and interferential current are not forms of NMES. They are used for symptom relief, not muscle activation. TENS, or transcutaneous electrical nerve stimulation, is primarily used for pain relief. It targets sensory nerves and is designed to reduce pain perception. Most modern TENS units use a symmetrical biphasic waveform, which helps prevent net charge buildup on the skin and improves comfort. TENS typically feels like tingling or buzzing and does not create a strong muscle contraction. It can be helpful for pain, but it's not a strengthening tool. Even though TENS and NMES may use similar waveforms, they're fundamentally different in how they're dosed. TENS targets sensory nerves for pain relief, while NMES is intentionally set to activate motor nerves and produce a muscle contraction. This difference is not just about turning the intensity up or down. TENS typically uses shorter pulse durations and settings designed to stay below the motor threshold, which means it creates sensation without reliably producing muscle contraction. Many TENS units are intentionally limited so that increasing the intensity increases discomfort rather than motor activation. NMES, on the other hand, uses longer pulse durations, structured on and off timing, and higher amplitudes specifically chosen to recruit motor nerves and generate force. Simply turning a TENS unit way up does not reliably turn it into NMES, because the underlying settings are designed for a different purpose. Interferential current is another form of electrical stimulation you may encounter, most commonly used in physical therapy clinics for pain control. It uses two medium-frequency alternating currents that intersect in the tissues, creating an interference pattern that produces a lower frequency effect at a deeper level. This is generally done with 4 electrodes that have channels that are in a crossover pattern. It can also be done with 2 electrodes if it's in a premodulated form. Because the currents cross, interferential stimulation is often described as feeling smoother and more comfortable than some other forms of electrical stimulation. Its role is symptom relief, not muscle strengthening. And that brings us to NMES. NMES, or neuromuscular electrical stimulation, is designed to create a visible, purposeful quadriceps contraction when it's being used at the knee. It can be used in other areas, but we're discussing it today for the purposes of improving quadriceps activation after knee replacement. And that's the foundation for how it needs to be set up and dosed to be effective. One specific way NMES may be delivered is through Russian stimulation. And Russian stimulation is a specific form of electrical stimulation that uses a medium-frequency alternating current, classically around 2500 Hz carrier frequency. And it's delivered in bursts to create a strong muscle contraction. And some people recognize the term because it became widely known in the 1970s and 1980s after reports of its use in training programs for Russian Olympic athletes. Those bursts are typically delivered at a burst frequency around 50 bursts per second, which places the stimulation squarely in the range used for strengthening. When Russian stimulation is set at a high enough intensity to produce a visible muscle contraction, especially when you actively contract along with it, it is functioning as NMES. This combination is part of why Russian stimulation has remained popular in rehab settings. The sinusoidal waveform feels smoother at the skin. The medium frequency carrier reduces skin resistance and the burst modulation allows the stimulation to act like a lower frequency strengthening signal. I use this a lot in the clinic. Together, that means many people can tolerate higher intensities, recruit more motor units, and generate stronger contractions, which is exactly what's needed for strength recovery. Because of those characteristics, Russian stimulation is most commonly available and used in physical therapy clinics where clinicians can adjust parameters and intensity safely and appropriately. So what does the research say? High-intensity NMES applied early after knee surgery and used consistently has been shown to improve quadriceps strength and functional outcomes compared to exercise alone. One of the most cited examples comes from work by Stevens Lapsley and colleagues, who found that adding early high-intensity NMES to standard rehabilitation led to faster quadriceps strength recovery and better functional performance than exercise alone. Findings like these are part of why NMES is supported in physical therapy clinical practice guidelines after total knee arthroplasty, reinforcing that it's not an experimental add-on but an evidence-backed option when quad activation is limited. And clinically, it's also very common for people to feel a surprising amount of muscle fatigue during well-dosed NMES sessions. And that fatigue is actually a sign that the muscle is being challenged in a meaningful way when technique and effort are appropriate. Using NMES early is important, and studies that initiate NMES within the first days after surgeries, sometimes within 48 hours, show better early strength recovery and improved function. How often NMES is used also makes a difference. In effective protocols, NMES is often used daily and sometimes more than once per day during the early postoperative period. But intensity is the biggest driver of results. NMES should produce a strong, visible contraction that challenges the muscle, not just a mild sensation. And it works best when you actively contract the muscle along with the stimulation rather than letting it do all the work for you. So generally speaking, when the intensity comes up and the contraction is starting, or when the stimulation is starting, I ask my patient to contract their quadricep. It might be with a quad set or a short arc quad or with some type of functional movement, sometimes in standing. So let's talk about setup, because this is where people often get stuck. Pad size is critical. For quadriceps stimulation, larger pads are generally better. Pads around 3 to 5 inches, which is roughly 7.5 to 12.5 centimeters, allow the electrical current to cover more of the muscle and distribute the stimulation more comfortably. 2 by 4 inch pads, roughly 5 by 10 centimeters, are very common, easier to find, and a little less expensive. Larger pads tend to cost more and aren't always as readily available. Smaller pads, like 2 by 2 pads, it's 2 inches by 2 inches, they tend to concentrate current into a smaller area, which can be more uncomfortable and less effective for recruiting the full muscle. Generally speaking, we use 2 pads on the quadriceps. A common setup is 1 pad placed higher on the thigh over the bulk of the quadriceps, and another placed lower, closer to the knee, but still on muscle tissue. In general, the pads should be spaced several inches apart, far enough that the current can travel through a meaningful portion of the muscle, but not so far apart that the contraction becomes unfocused. If pads are placed too close together, the stimulation tends to stay more superficial and can feel sharp or uncomfortable without producing a strong contraction. When placement and spacing are appropriate, you should see the muscle tighten and feel the kneecap being gently pulled upward toward the thigh. Skin preparation is important. Clean the skin with soap and water to reduce resistance and improve comfort. In general, avoid abrading the skin with a towel or the alcohol wipes, as they can dry the skin and increase irritation. However, if there is lotion, oil, or residue on the skin, a brief wipe with an alcohol wipe may be needed so the electrodes can adhere properly. Always check the skin before and after treatment. Long or dense leg hair can absolutely interfere with electrode contact and make the stimulation feel less comfortable or less effective. If hair is thick, trimming it with clippers or scissors, not shaving, can improve electrode adhesion and comfort. Unfortunately, shaving can irritate the skin and increase the risk of irritation under the electrodes, especially early after surgery. Now let's talk about what NMES should feel like. For strengthening, NMES should feel strong. You should see the muscle contract clearly, and this is where many people underdose. If the stimulation only feels like tingling and there is little visible contraction, it's unlikely to provide a meaningful strengthening effect. The goal is pretty intense but tolerable stimulation. It should not feel painful, but it should feel like the muscle is working and you are working at the same time. During the stimulation, you can either allow the machine to do the work, but it's really best to actively contract your quadriceps at the same time. Early after surgery, passive NMES might be more appropriate if it's very challenging or difficult to contract the quad. But you really should be progressing into adding a good active contraction during the stimulation to help retrain that brain-muscle connection and improve voluntary control. Most strengthening-focused NMES uses a pulse current with frequencies commonly in the range of 50 to 75 hertz and pulse durations in the several hundred microsecond range. Typical protocols include an on time of about 10 seconds followed by a longer rest period, often around 50 seconds. And that rest time is important because it allows you to tolerate higher intensities and produce stronger contractions without excessive fatigue. A typical session may involve a series of strong contractions similar to doing repetitions of an exercise, and in some research protocols, this might be 10 to 15 contractions per session, performed once or twice a day in early stages of recovery. And one of the most important things to remember is that NMES is not a replacement for exercise. It's a supplement. It helps you to activate the muscle so that your strengthening exercises are more effective. It's a bridge that helps you reconnect with your quads when voluntary activation is limited. If you've tried electrical stimulation before and felt like it didn't help, it may not have been you. It may have been the dose. NMES works when it's set up and applied correctly. But when it fails, it's most often because the intensity, frequency, or the overall dosing wasn't enough to meaningfully challenge the muscle. This can be hard to achieve consistently in a traditional outpatient physical therapy setting, where NMES may only be used a couple of times per week and for short periods within a session. Once someone has learned proper setup, safety considerations, and how strong the contraction should be with guidance from their therapist, it's reasonable to ask whether more frequent use at home could better support recovery. And that's a conversation to have with your rehab professional. So NMES is used appropriately, safely, and as part of a broader strengthening plan. I'll share at least one link in the show notes to some NMES resources, including a stimulation unit you may want to explore further. If you're curious about what these devices look like or how they compare, the show notes are a good place to start. And some of these links are Amazon affiliate links, which means I may earn a small commission at no additional cost to you. So before we wrap up, I want to remind you that recovery works best when you have a plan. If you're preparing for knee replacement and looking for structured guidance before surgery, my knee replacement game plan book is being created specifically to educate and support people during the prehab phase, the valuable time spent preparing before surgery. To learn more and to be notified when it's released, click on the link in the show notes or visit totalkneesuccess.com. And I want to remind you again that the Total Knee Success podcast is for educational purposes only. And as we close today's episode, let's look ahead. In the next episode, we'll talk about walking speed as a vital sign after knee replacement. That's an interesting way to put it. And let's talk about how gait speed can help guide safe, confident progression back into everyday activities. The goal stays the same, to help you move forward with clarity, confidence, and evidence-based guidance you can trust. You're not behind, you're rebuilding, and if NMES feels like it might be a missing piece in your recovery, that's a conversation worth having with your physical therapist so it can be used thoughtfully and effectively. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com and be sure to subscribe and share because every step forward takes you closer to living the life you love.